Hi, my name is Dr. Nilam Khurana, and I'm going to talk to you guys about dyslexia. Now, I'm not an expert in dyslexia. Pediatricians really don't know anything about dyslexia from training. And funny thing is, a lot of teachers don't know anything about dyslexia from training. And we just keep passing the ball over to each other, and lots of kids are falling through the cracks. And so, in being blessed with having a child with dyslexia, I got to learn a lot, and I just wanted to share that information with you guys so you can have more information on what to look for and when to get extra help and figure out what's going on and move forward from there. So dyslexia is a very interesting thing. It's oftentimes misdiagnosed as ADD or ADHD. And it can come in combination with that too, of course. But it's not necessarily something that is a developmental delay. So you can be super smart and have dyslexia, because dyslexia is simply an inability to see things in a two-dimensional space. So when they see their B's and their D's and their P's, they flip them in three-dimensionality. And those kids are also able to see things like maps and understand space much better than kids who don't have dyslexia. So, but what happens is it becomes a task and a challenge when you're having to read and write, especially in the beginning with those short words and those small things, because they end up taking the shape of the word and guessing what it is. So fire can be 5, on is no, lots of different words like that. So then, okay, you can imagine if you're trying to read something and all of a sudden the sentence is about something being on fire and they're saying no 5, it doesn't make any sense at all. So there's different ways to help them learn how to read if we get that early diagnosis. And so typically they are still going to flip their letters and stuff when they're young and when they're first learning. After a year and a half of education on letters and writing, typically by the middle of first grade, they should stop flipping the letters. If they've had preschool that's been intense, it can be sooner. There's other things that they do that can be signs that they have dyslexia, mixing up sounds when they're saying things, mixing up the blended sounds when they're saying things. So aminals versus animals and Paschetti versus spaghetti, and carrying that on a little bit longer than you would expect for their age. So these are the early signs of dyslexia, and then they can carry over to having lots of other additional problems, including flipping numbers. Then it becomes an issue with math. Even if they're really great with their math facts and they understand the math, being able to read and write those numbers can be an issue. And it just goes on and on. So the first 3 years of school are learning to read. And then after that is reading to learn. So if your child has not reached that potential to read by the end of 3rd grade, that's when we start seeing the struggles. So typically kids with ADHD have had issues all along, and if they've not outgrown it by the time they're 5 or 6, typically 6, then that's when we say, oh, there may be something. But a lot of these kiddos that just have dyslexia don't have any of those other behaviors. They have different things that they do, but they're not totally hyper, bouncing off the walls, or unable to focus on other things in life. They have a difficult time focusing on this, because you can imagine sitting in a room for 8 hours a day doing something that you can't do. There's many other things that affect them. Some kids will have a hard time copying things off the board. And there's just so many factors into it that it then becomes an issue of low self-esteem and anxiety and sometimes depression if it's not treated early enough. And actually, we know that kids with dyslexia are at a higher percentage rate in juvenile detention centers. It's not that they are more likely to be bad kids. It's that they're more likely to struggle in school, be misunderstood, and get frustrated, and then go down an incorrect path, not the path that you want them to go down. So that's just a little bit about dyslexia. Diagnosing it is a little different and difficult. Usually neuropsychologists can diagnose it. Some schools will help with the diagnosis. There's, although not very common, at least here in Arizona. And then you typically don't have a pediatrician that can help you. You can ask the school to do the evaluations, which is a psychoeducational evaluation. And if they do that and they do the right testing for phonemic awareness and understand the discrepancy between their verbal comprehension and their reading comprehension is big, and find that they are not hearing those blended sounds. They're not able to say those blended sounds. They're not able to write things the way that they should for their intellectual level. Then they can put things together and have dyslexia as a diagnosis, but it's not that common that it happens through the schools. So typically a parent has to go out and look for it. You have to go to a neuropsychologist or somebody who can diagnose dyslexia. But again, as a parent, if you're not aware of what to look for, and the teachers aren't aware of what to look for, then you just end up lost for a long time. So I'm hoping this video will help families see those early cues and early signs of their kiddos when they're struggling with something like this. And, you just get it checked. Worst case scenario, they don't have it. Best case scenario, they have it and you already know, because finding out what is going on is the first part of the issue. And then once you figure that out, you can move forward with different forms of treatment. And I'll talk about that on another video. So that's it for now. Thanks for listening.